start again?
Yes, you can cut out the front part. Hi, Natalie. Hi, Natalie.
Hi Charlie, how are you?
I'm good, thanks.
Good. You're here for the Engage in Workplace Communications workshop today?
Yeah, that's right.
So my name is Natalie, I'll be your trainer and assessor today. Before we get started, do you consent to this workshop being video recorded for quality and training purposes?
Yes, no problem.
That's good. So a few housekeeping to start with. Today is going to be a 30-minute session. It will be including the training and then followed by assessment at the end of the session. If you have any phone calls that you need to attend to, that's okay. Just let me know and then you can take the call outside. Emergency exit is just down the hallway to the left-hand side through the garden. That's where our emergency gathering point would be. Any questions on that so far?
No.
So to start with, we'll do a acknowledgement of the country. So I would like to begin by acknowledging the traditional owners of the land on which we meet today. I would also like to pay my respects to elders past and present. So you are doing nursing, right?
Yes.
Yeah. So I have come up with a few workplace related topics that we can have a quick chat about that would help you in getting into a workplace communication, since you're not too familiar with our system, and also you find speaking in English, which is your second language, is a little bit difficult to get the clarification and to express yourself, is it?
Yeah, that's right.
Yeah, that's okay. So what do you think are the common nursing conversation, everyday conversation that you will be having at work?
Talking about patients, communicating to the patient's families, to the nurses in charge, and writing reports.
Yeah, yeah. So that's good. Like a lot of oral communication in that field, actually. You talk to the patients. You probably talk to doctors, talk to your in charge, talk amongst your colleagues, and specifically, I have come up with three scenarios here, three different times that you will need to have the oral communication regarding the patient or to the patient. So first, when the patient comes in, you do the admission assessment, you gain the history, know why they're coming into hospital, and also complete your assessment. So all these would involve your oral communication skills. You're probably going to ask them a lot of questions, trying to get their history, whether they have any family history before, things like that, or if they have any allergies, whether they have been admitted to hospital in the past for the same reason, things like that. And when they are going home, you probably need to communicate with them about their discharge plan as well. So things like how they care for if they have a wound dressing to go home with, how they're going to care about it, and then what's the instructions specifically for the wound dressing, whether they need to follow up with the GP or whether they are required to come back in for an outpatient appointment. So these are the things that you want to make sure your patient is understanding thoroughly before they go home as well. So a lot of oral communication involved in there, as well as like a handover. There will be a lot of times that you do handover. Pretty much every day, every shift, you'll be doing handover, whether you're receiving a handover at the start of your shift or at the end of your shift, you will probably give a handover to the next nurse taking over. So there's also the oral communication there where you need to talk about the patient using a nursing specific framework, a template that we're not going to get into too much detail here, but you want to make sure your communication is clear and easy to follow as well. So what do you think makes an effective workplace communication?
Being able to communicate clearly, getting along with obviously my colleagues, people that I work with, as well as patients.
Yep, yep, that's good. So effective communication, it also depends on what you are trying to communicate, whether you're doing a presentation or if you are just talking to them normally, like if you're doing everyday patient contact. So to start with, for all kinds of different types of communication, you need to know your audience, so you need to know what they need to know and what they're trying to get out of your conversation, and also gauge how much understanding they already have, how familiar they are with the topic. Things like if you're talking to a patient that their health literacy is quite low, then you probably would want to break it up in more simple terms. Whereas if you're talking to your colleagues that it has the same similar nursing knowledge that you have, then you can probably use more professional words or more nursing specific language. You also want to make it clear and concise as well. You don't want to go around the topic, and you want to stay on the point, be focused on it as well. You want to be engaging because especially if you're doing a PowerPoint presentation or if you are trying to show something on the computer, you want to make sure you have the visuals, you have the engaging slides, and your presentation format is consistent as well. And if you're using other materials to support your communication, you want to have an equal balance between your oral, your visual, and also if you have any handouts, you want to make sure you utilize all those materials as well. If you're having a conversation with others, rather than having it one way, it's always good to have an interactive session, some mutual two-way communication would be good. It's also to part of the engaging process for your presentation as well, to make sure that you are having those audience focused on what you're saying, and you can ask questions, engage your audience, encourage them to participate in your presentation, and making sure they understand, so it's like a knowledge check as well, and want to also prepare what you're saying, so rather than going in not knowing what exactly to say, you have a read of your handout first, think about what else that could be missed, and then go in from there. So, know your audience. Do you understand what that means?
Yes.
Okay. Can you explain to me what your understanding is?
As you explained just now, you want to understand where they're coming from, how knowledgeable they are, being able to speak in simple terms where they can understand, and yeah, just building rapport with everyone.
Yep, that's good. That's good. So you want to know exactly what they need to know and how much they already know before. Clear and concise. So pretty much what we said earlier as well. You want to start with your objective, telling your patients, oh, I'm here to talk to you about this, this, and that. And you want to make sure you have a clear structure, and if you are doing any presentation, you also want to apply the typical questions on that?
No.
So yeah, engaging, like we said before, we want to use visuals to keep your audience engaged. So the whole presentation is not too boring. You want to make it consistent as well. So rather than different colors everywhere, and you want to have a theme. Also utilizing your spoken, visual, printed materials. All good here?
Yeah.
So being interactive, like what we said before, the whole time we want to keep your audience engaged. With that, especially oral communication, we have what we call the 5 Ps. So pitch, pace, pause, projection, and personality. So all these 5 Ps can sort of modify how you deliver your speech. So to make it more interactive for your audience as well, you're not going to sound like a robot monotone. So it also helps with your audience to understand what you're trying to say. Is that quite clear?
Yeah.
So, yeah, how do you think you can be interactive in workplace communication?
It would definitely help if I know my audience. Getting everyone to participate and ask or prompt people to ask questions.
Yep, yep. So, like what we said before, rather than having a one-way communication, you want a two-way communication. You can ask the questions throughout your communication, whether it was a presentation or just having a knowledge check. You can, that way, your audience will have a chance to clarify on any questions that they might have as well. If you're delivering an idea to a big group, you can also get group discussions in or any quizzes that you want to put in to make sure they are engaged and understand the messaging as well. So preparation, how do you think you would prepare if you need to go into a patient's room and let them know that, let's say, dinner is delivering late?
As in, how do I prepare to tell them the dinner's late?
Yeah,
Or?
yeah. Like, would you have to go through any? Would you need to call the kitchen first, or would you need to talk to anyone else first, or any materials, any substitutes that you would offer?
Yeah, I suppose find out how late the dinner will be number one. Just in case they'll likely ask that, whether it's 10 minutes or 3 hours late. And once I know that, I will, if it's not too much longer, I will just gently let them know. If it's quite a long wait, then I would try to find snacks for the patient to eat.
Yeah, yeah, that's good. So you prepared for that conversation, you sound confident and you're comfortable to have that conversation with your patient. You're predicting what they're going to ask and how you're going to respond. You probably offer some snacks or something. So in that case, you're not just going into that conversation without any solution or any offers to your patient. But otherwise, if you are delivering a presentation, you can also prepare your venue. So you want to set up your venue, practice your presentation, make sure it's within its time limits, check your equipment, make sure they're not faulty, and keep yourself hydrated as well, because you might be nervous, who knows. Yeah, are we quite clear on that?
Yes.
Okay, so remember, you should keep eye contact. If you're talking to a big group, you can focus in the middle of the group and then sort of shaking their heads, then you have a brief idea of knowing whether they understand what you're saying or not. And also the 5 Ps. Good?
Yeah.
Okay, so let's practice on some scenarios. So we're gonna have 2 scenarios here that will help you prepare for any workplace communication. So I've got some nursing specific ones here just to see how you would approach the conversation. So first scenario, you've got Oscar. Oscar, who is your patient, he would like to go to the bathroom, but you need to understand how he normally mobilized first before when he was at home, before you help him to the bathroom because you don't want him to have a fall. So a little bit more about Oscar. He is 90 years old. He has dementia. He came in because he had a fall at home. And he says he's been feeling dizzy when he stand up as well. But he normally uses a frame to walk, but he did not bring it into the hospital with him. So how would you talk to Oscar? Let's say if I'm Oscar and I say I want to go toilet.
Given I know his conditions like this, I would probably let him know that, given he has issues just even standing up, I would get a separate pair of hands for assistance to get him to the bathroom.
Yep.
In a safe manner.
All right. So I'm just gonna pretend I'm Oscar. Hi nurse, I really need to go to the bathroom. Can you help me, please?
Yeah, sure. Give me 5 minutes. I'm just gonna find someone to help me.
Yep. So other than that, would you also explain to him a bit more why you need to find another person? So, I really need to go now. Can you just take me to the toilet?
I'm not strong enough to carry you, so I need someone else to help me.
Oh, you've got muscles. I'm quite skinny.
Okay, let's go.
So, in this case, you started off really good. You have explained to him that you need someone else to help with because Oscar is very adamant that he needed to go to the bathroom now that you are happy to take him on board. So that is your communication with him regarding your risk assessment. However, I would probably explain to him a little bit more of why we can't take him to the toilet right now. So I'll probably go with, I'm just gonna go and get someone else to come and help me. And because you had a fall at home before, I just don't want to take you to the bathroom. And if it's just me, I might not be able to help you. And then you have a fall, you're gonna hurt yourself again. And before you also said you felt a bit dizzy standing up, so I just need to double check your blood pressure and making sure how you feel before you start walking to the toilet, because I don't want you to pass out in the middle of the hallway. And you also didn't bring your frame, so I just need to figure out how you're gonna walk before we get you a frame first. So I'm gonna get someone else to help, or why don't we get you a bottle? Would you be happy to use a bottle in bed? So it's just about explaining the scenario to Oscar and also offering him some alternative. In this case, Oscar has dementia, so it's gonna be a bit tricky to explain to him. So you probably want to use more simple words, more direct, in that way for him to understand.
Okay.
Would you like to try again?
No, I think I understand.
Okay, should we move on to the next scenario?
Yes, sure.
So, next scenario, you've got Tilly. Tilly, who's your patient, would like to go and get a coffee, but she's actually fasting for a procedure at the moment. So you need to explain to her that she cannot have that coffee right now, but you're happy to offer her a coffee after she returns from her procedure. So Tilly is 20 years old. She has good capacity to understand instructions. She just really wants a coffee because she hasn't had one for 3 days now. So, hey nurse, I really want a coffee. I normally have it every day, but since I've been in hospital, I haven't had one, and I just need that caffeine right now. Can I go and get it? It's just downstairs.
Sorry, Tilly, you have to wait after your procedure because it's very important that you fast prior to your procedure, and you cannot have any coffee before this operation takes place.
But it's just a coffee. Like it's only a small cup. I'm sure it'll be okay.
Yes, but the contents in the coffee would cause complications if you have had it before you enter the surgery. So you better not have it.
Is it that bad?
Yes, yes.
Okay. What about after?
Yeah, after will be fine, perfectly fine. I'll get a coffee ready as soon as you finish your surgery.
Okay. I'll wait for my coffee then. I'll wait for the procedure first.
Okay.
So, how did you feel about that one? Do you feel better about this scenario, this conversation you had with Tilly, than the one before with Oscar?
Yeah, a bit better.
Why is that? Why do you feel like this one went more smoothly?
She was easier to talk to because she has, capacity to understand. She doesn't have dementia. She is 20 years old. She wasn't fighting back that much. So
Okay. Yeah, so unfortunately in the workplace you'll encounter like different type of patients, especially being a nurse. So but that was good. Like you were able to explain to Tilly why she couldn't have the coffee. You are also engaging with her and like answering her questions directly. At the end, you were able to sort of um, resolve her question with offering her a coffee afterwards. So yeah, I think that was good. So are you ready for a quick assessment?
sure.
Yeah, so this assessment is similar to the scenarios. You're also required to do a oral communication with one of your patients. So your patient is Alfredo. Alfredo is for discharge to go home today. You need to provide the discharge instruction for your patient before Alfredo leaves hospital. So you want to make sure Alfredo understands that he needs to make an appointment with the GP next week after he goes home. You want to make sure Alfredo has already received the scripts from the pharmacist before they walk out of the hospital. All the discharge summary and the medical certificate has already been given to Alfredo before he walks out, and he's got everything that he brought into hospital to bring home, and you want to find out who is picking him up from the hospital.
Yeah.
Do you need a minute to figure out how you're gonna prepare the conversation?
No, we can go into it.
Okay. Alright, so I'll be Alfredo, you will be my nurse. Hey nurse, can I go yet? I need to go home, I've still got work to do at home.
Hi, Alfredo. Yes, yes. There's just a couple of things that we need to make sure you receive before you leave the hospital, and it's very important that um, every single um, actions is taken before you leave.
Yeah.
So here are some documents. This is your discharge summary and your medical certificate. Make sure you keep that with you. And obviously you've already packed your all your bags. Just double check if you have left anything behind. Otherwise, if there's anything, just give us a call and we'll find it for you. Most importantly, it is very crucial that you make an appointment with a GP next week for a follow-up appointment. this is very important because you know you need a regular doctor follow up on your current condition. So make sure you book this ASAP.
Okay. Anything
And
else?
prior to
I'm running out of time. I need to go.
yeah, okay. Let me just walk you to the pharmacist. I just want to pick up the scripts with you. They're on the way out, so everything's on the way. So they'll just pass me the script, and I'll make sure you have it before you leave the hospital.
Okay. Okay. Oh, actually, I think I've left some medication. The first day I was here, the nurse took it to keep it in the medication room or something. Can you just go and check?
Yeah, sure. What medication this is for?
I think it's my insulin.
Oh, okay. No worries. That's fine. We can leave it there. We can pick up a new set from the pharmacies downstairs. So.
Okay. All right. Um. I haven't got anyone to pick me up. Like, do you do taxi voucher?
Yeah, definitely. Let me call you an Uber or a taxi.
Okay. Um. Anything else before I go?
Nah, that's it. Just make sure you book your appointment and let's go grab your scripts.
Okay. Yeah, I think that was good. That way that you have made sure and emphasized the importance of Alfredo making a GP appointment. You have also made sure that Alfredo has got the scripts by also walking down with him to the pharmacist and explain the discharge summary and medical certificate. Throughout the conversation, you engaged, made sure that I understood the instructions, and in the end, you also helped with his pickup. So that was good, I think. I'm happy to say that you've done well in this assessment. Um, so I'm just gonna do your feedback form. In the meantime, how did you find this training session?
Yeah, it's very interactive with all these scenarios. I find it very helpful to develop my skills further and definitely need a lot more improvement. Um, and yeah, the specific workplace topics are actual real life scenarios that can happen. So it sets a very good feedback to what I need to work on and improve.
Yeah. So yeah, I think you would really benefit from that specific workplace topics like what we discussed. So I think if you would like, we're happy to do another session for you, focusing on the different workplace specific topics as well. So, with your assessment checklist, I'm happy to say, yep, you spoke very clearly and your pace was good. Your tone of speech was also very good. You have different pitch and maintaining the eye contact. You were also very confident and knowledgeable. Um, Yep, your discussion was within an appropriate time since Alfredo was rushing. You were happy to shorten the discussion, do multiple things at the same time, walking him down to the pharmacist while you explain other instructions. And yeah, your vocabs and workplace specific keywords were also very on point as well. So I'm happy to say you have passed the assessment, and the only feedback that I'll give you is maybe you can also sign up to our next session, which is also nursing specific oral communication as well.
Yes.
Would you be
Definitely.
interested in that?
Let me think about it. But yeah, this sounds interesting.
Yeah. If you are interested, you can also reply to my email that I sent you last week. There will be my contact details in that email.
Sure. Will do.
Okay. Any questions for today?
No.